So good to see you all, and thanks for the invitation to TOA. So, is this moving? It is good. Okay, great. So, mental health is what I'm talking about today. And just to ground this, mental health is really significant. It's as common as physical health. Ill health is as common in the mental health, say, as much as in the physical realm. But if you're physically ill, you'll tend to get treatment. If you're mentally ill, you generally won't. A, because you probably won't turn up for treatment in the first place, and B, because if you do, there won't be any resources to treat you. So it's a big, big problem. And there is no health without mental health. You cannot be healthy without mental health. If you don't look after your mental health, your physical health will suffer too. It's a fact. So we've got to do something about this. So imagine if we could transform someone's mental health condition in just 2 or 3 hours of VR. So something really, really simple, something accessible, that doesn't need a highly skilled clinician, that actually is easy for you to turn up and do without all the stigma of going to a mental health clinic. So I'm going to show you a couple of videos of people who have severe acrophobia. So this is a severe fear of heights. And this guy, Dick, you'll see he's pretty uncomfortable. He's got sweaty palms. He's palpitating. We've asked him to look over the barrier just ahead of him. This is the first floor of a shopping centre in Oxford. And he gets there. He's looking pretty unhappy, as you can see. And eventually, he clings on, peeks over, and that's as much as he can do. That man is in real anguish. Here he is in VR, and something special is going on here. He's actually confronting his fears, but in this virtual environment. And he's learning to challenge his intrusive thoughts. And he goes back after 8 sessions of 20 minutes and just peers over the barrier. It's snowing, it's pretty hazardous compared to the way it was. He's pretty relaxed about it all now. And then even more amazing, he goes upstairs to the next level.
This would have been simply impossible 3 months ago. It would have been total avoidance. I wouldn't even have attempted this.
So he spent his entire life avoiding heights, which actually really affected not only his personal life, but his working life as well. And he's suddenly overcome it really quickly. Now, another lady, this is Faye, who has a particular fear of heights. She has a general fear of heights, but she really doesn't like escalators. And this is a pretty big escalator in the same shopping centre in Oxford. And she gets to the edge, and she doesn't like it. She's a bit less kind of disturbed by it, she just can't do it. So here she's in VR.
Do you feel safer around heights than you did when we first arrived on this floor?
And this virtual coach is really important, we'll come back to that. And then she gets back on the escalator.
I can't believe it. It's really, really weird. It's fine, I don't even need to hold on. That's so weird.
That's what every therapist wants to see after a therapy session. Now, the thing about Faye, she did that in 3 hours. So when we contacted her, she was in the control group of a clinical trial that we did. And she said, the problem is I've only got a morning. That's all I've got. I can't come back after that. So we did the first video at 8 in the morning, the second one at 12 o'clock. She did 3 hours of VR, in fact, 2 hours of VR in 3 hours. So 20 minutes on, 10 minutes off, and that was the impact. Quite extraordinary. So all of this work isn't new. This has been going on for a very long time at the University of Oxford, with Professor Daniel Freeman, 18 years, in fact. And so there's a lot of research behind this. And we base it all on this very simple model. So the cognitive model really is the brainchild of the Beck Institute in Philadelphia in the US. And the idea being that your response to a situation, which is what mental health conditions are, they're abnormal responses to normal situations. Your response is really based on your intrusive thoughts, the automatic thoughts, the visceral feelings that tell you something bad's going to happen here. And the way to change that is to get you to understand those visceral feelings and thoughts and deconstruct them. So typically you do that in a number of different ways, whether it's through face-to-face therapy, online psychoeducation, online guided self-help. All of these things are ways to get you to understand what are the triggers, how do you identify those triggers, and then how do you stop yourself from responding in that way. The problem is, with all of these, you actually have to go out into the real world and take a real risk in the real situation to overcome these fears. So imagine if you could take this risk without taking any risk at all. So here we have somebody with a headset on, and she's saying, cracky, this situation is making me feel really anxious. I really don't feel comfortable. However, I know I'm standing in a lab with a headset on. Nothing bad can happen to me. I know that. So my mind's telling me two things. So this paradox enables us to do this really clever thing. We can mimic the challenges of the real world. We can deconstruct them and understand that these intrusive thoughts aren't helpful. And really important to that is this lady here, Nick. And Nick is our virtual coach. And she does much more than guide you through the tasks in the program. She also reminds you, as you're going through why you're doing the task, you're challenging these visceral responses. So I'm going to let Daniel Freeman just talk about this for a moment.
The wonderful therapeutic mechanism underlying VR for mental health conditions is that because a person knows the simulations aren't real, they can try things differently in the situations that trouble them. But the learning they make in VR transfers to the real world. The key innovation of the work of Oxford VR is the automation of psychological therapy in VR by using a virtual coach. By automating the therapy, we can ensure millions more people get access to the very best psychological treatment.
Sorry, my button's not working for some reason. Somebody help? There we go, good. So, as you saw, we did this acrophobia treatment, which was our proof of concept. We put it through a clinical trial, the largest ever trial of fear of heights in the world. And we saw a 70% reduction in fear, which is about twice what you'd expect for traditional methods of treating people, which is extraordinary. And this was all in very, very short interventions. That's now routinely deployed in a number of NHS services in the UK. There we go. So, and based on this work, we're developing treatments for a whole range of conditions. And the key thing for all of these mood and worry disorders is making them faster and more effective than standard treatments. Much lower cost to the health system, which is, to get things adopted, they've got to be cheaper. But critically in mental health, something people want to do. People are really stigmatized about mental health. And if we can make it something which is quite appealing, then we'll see people adopting it much more. Okay, so really the first program we have working with this is in Asia. So we've just signed a deal with AXA in Hong Kong and the Chinese University of Hong Kong. And we're treating people in Cantonese, English, and Mandarin for anxiety and depression disorders. So this is a really big program that's just starting in the next few weeks. And if you think about Hong Kong, this is one of the most high-octane lifestyles in the world. It's one of the most densely populated parts of the world. They have the longest working hours by some margin. It's an incredibly tough culture to live in. And of course, if you live in that culture, stress is a key part of it. And there's this really nasty vicious cycle that leads to mental health conditions. Stress leads to low mood and worry. Worry will lead to intrusive thoughts, which will stop you from doing things. You'll start avoiding situations. The more you withdraw, the more you avoid. Actually, the more stressed, the more worried you become. So you end up in this real spiral, and you withdraw into yourself. And this is a common problem amongst mental health disorders. And so what we're doing with the VR is a very sort of simple CBT model of breaking that cycle and reversing it. And reversing it is by giving people positive experiences in everyday situations in the virtual world, which means they can challenge their intrusive thoughts. It means they can actually improve their mood, go and try things in the real world, get a positive experience, and then the cycle goes back the other way. So this is a really simple method, but it's really effective as well. And so we have a number of scenarios that we put people into where they perform particular activities guided by the coach. This is a street, we have a bus, we have a cafe, this one is a convenience store, and then finally we've got a GP's waiting room. Now, GP's waiting room is really important. We'll come back to this in a moment, but people with poor mental health not only are likely to actually suffer from worse physical health, partly because they don't look after themselves, but actually there is definitely a connection between mind and body here, which creates this problem. But the other thing is that when they're unwell, they find it very, very hard to go to the GP, to their doctor, to get treated. So minor physical ailments become really, really serious ailments for them. So this is all great. We've talked about anxiety and depression disorders at fairly low-level primary care, even up to sort of fairly severe things of people who are withdrawing. But actually, imagine if we can use this to treat really serious mental health conditions. Things that, if you look at the mental health spend, any country in the world is pretty much the same. Around 90 to 95% of the spend is spent on a very small proportion of the people who have really serious conditions like personality disorders, psychosis, bipolar disorder. Psychosis, for example, in the UK, consumes 30% of the mental health budget for a tiny number of people, 200,000 people. So it's really disproportionate. So we are now part of a program called Game Change. Now, this is a large NHS research-funded program. It's a £4 million program. It's working across 5 areas of the UK, 5 NHS trusts, which are effectively hospital regions, 5 universities, and a number of other partners, including a patient advocacy group. Now, this program is really key because these people with psychosis, the biggest challenge they have is that their average life expectancy is 14 years less than the rest of the population. Now, that's not to do with the psychosis. It's not to do with their sedentary lifestyle. I mean, they may well have a sedentary lifestyle because a very common impact is to withdraw, as I was describing earlier. There's something more going on there, which is really challenging. So if we can get these people to engage more with society, to do more real things, like catching a bus, going to a shop, going to a bar, going to their doctor, actually, when something's going wrong, when they're about to hit crisis, we can identify it, they can identify it, and they can do something about it. But at the moment, the barrier is so high. So when we meet, we have a lived experience advisory panel that was assembled by a charity called the McPinn Foundation for us. And this is made up of people who've lived with psychosis for many, many years. And the common thing they say is that not only can they not bring themselves to get out and do things, they just don't know where to go for help. And even if they knew where to go, they couldn't ask for it. So by creating this virtual environment for them to really challenge their intrusive thoughts and to recover from this withdrawal and to engage more, we hope to get these people to live a much more fulfilled life. So there's 432 patients on this trial. It's the biggest trial of its kind anywhere in the world ever. It's a huge program of work. And it's not based on hope. It's actually based on a small pilot study that we did last year in Oxford with 30 patients in a cut-down version of this, actually in a shopping centre, navigating various shops and interactions with people. And the effect of that was really strong, and we expected to see a similar result from this. So the trial starts this week. It lasts for a year. We then spend a year writing up, and really key to this is it's really to de-risk the commercial proposition here. Part of the funding is to write the health economic case for this as well. So the NHS will deploy this if it works, if it's cost effective. And I hope we'll do that similarly across health systems all across Europe and the world. So we like to think, I think delivered is probably a bit strong here, but I'm looking at Simon, my marketing man over there, but actually we are delivering imagination. So I've spoken a lot about imagining things this afternoon, or this morning. It is this afternoon, isn't it? And we are driven by imagining better mental health for people. That's what drives every single person in this company. But what's so exciting is we are delivering it, and we're delivering it every single day. So thank you very much, and I welcome any questions.
All right, so it looks like the top voted question is, can you use VR through programs in a more positive psychology setting to increase productivity and, where did the question, well-being?
Okay. Yes.
Yeah, that's a great answer.
Because I think people's productivity is limited by their anxieties. So we've all worked with people who will check a document 15 times before they send it because they're really worried about making a mistake. That's an anxiety disorder. It's pure and simply an anxiety disorder. It's not a clinical disorder, but it's limiting their daily functions. So there are a number of things that we can do to help people to overcome those challenges in their daily lives. People who don't want to talk to their boss, bosses who don't want to talk to their staff, people who don't want to have frank conversations with each other in the workplace. All of these things can be treated using this method. But I have to say it's not our focus. Our focus is on the clinical end of this. We see the real need being people with serious clinical conditions whose lives are really disrupted. So we may get there, but at the moment our focus is pretty much laser focused on this clinical market.
Amazing. Thank you so much, Barnaby.